Hi, I am Linda. In this video, I shall explore the meaning of inflammation. It is a vital part of the immune response. The job of inflammation is to help your body to heal itself from harm. However, it causes various health issues when it continues and becomes chronic. These can include heart disease, diabetes, arthritis, and certain cancers. You can reduce chronic inflammation by changing your diet, lifestyle changes, and medical interventions. In this video, I shall delve into the complex methods of reducing inflammation in the body. I shall cover the understanding of inflammation, types of inflammation and causes, which foods to eat and to avoid, and much more. Inflammation is a complex biological response to the body's reaction to damaged cells, or irritants, like if you cut yourself or fall scraping your skin, or from bacterial or viral infections, such as the flu or urinary tract infection, or a disease such as arthritis, lupus, and other diseases. Understanding inflammation requires an exploration of its key workings. There are 3 phases to inflammation, which are: Number 1, the beginning phase. The inflammation is activated by an injury, infection, or disease. This is when the immune cells are activated. Number 2 is the extension phase. This next stage is recruiting more immune cells to the area of inflammation, leading to the growth of the inflammation response. The third phase is the resolve phase. This is the last stage where the process is to clear out necrotic cells and tissues that are damaged from the injury and the inflammatory process, and establish a repair process. By reducing inflammation, the tissue begins to repair, and homeostasis is restored. This phase is crucial to prevent chronic inflammation. The signs of inflammation can include redness, heat, swelling, pain, and you could also have loss of function. If you have arthritis, the inflammation can last a long time and become persistent. It can last for months or years. Chronic inflammation can lead to tissue damage and is implicated in a wide range of diseases. Understanding the causes of chronic inflammation is vital so that you can help with prevention and treatment strategies. If you have arthritis, the inflammation can last a long time and become persistent. It can last for months or years. Chronic inflammation can lead to tissue damage and is implicated in a wide range of diseases. Understanding the causes of chronic inflammation is vital so that you can help with prevention and treatment strategies. When you have inflammation, you should avoid things like Number 1, processed foods. These are often high in added sugars, unhealthy fats, and preservatives, which can trigger inflammatory pathways. They could be processed meats, sugary snacks, and fast food are common examples, and others. Trans fats are found in fried and commercially baked goods. Refined carbohydrates. Foods high in refined carbohydrates, such as white bread, pastries, and sugary cereals, can lead to spikes in blood sugar and insulin levels, which promote inflammation. High glycemic index. These are foods that cause a rapid increase in blood sugar levels, leading to inflammation. If you have excess alcohol, this can lead to liver inflammation, known as alcoholic hepatitis, and can contribute to systemic inflammation. Number 2 is if you are obese. It is the main risk factor for chronic inflammation. Excess fat, especially gut fat stored around the organs, acts as an active endocrine organ that releases inflammatory mediators. Obesity is closely linked to insulin resistance, which is associated with elevated levels of inflammatory markers. Number 3 is chronic stress. When you have any disease such as arthritis, where you are living with pain and inflammation, you may feel emotional stress, which can lead to chronic inflammation by affecting the body's hormonal balance and immune function. This can lead to a prolonged release of cortisol, a stress hormone that can suppress the immune system and autoinflammatory responses, or a persistent activation of the sympathetic nervous system due to stress, can lead to increased production of pro-inflammatory cytokines. Number 4, infections. Persistent or unsolved infections can result in chronic inflammation. These infections may be due to bacteria, viruses, fungi, or parasites. Chronic bacterial infections, including those caused by Helicobacter pylori, which is linked to stomach ulcers, or tuberculosis, can lead to prolonged inflammatory responses. Or viral infections such as hepatitis B and C can cause chronic inflammation of the liver. Number 5. An autoimmune disease can occur when your immune system goes wrong and wrongly attacks the body's healthy tissues, which then leads to chronic inflammation. These can include rheumatoid arthritis, where the autoimmune disorder in the immune system attacks the joints, causing chronic inflammation and joint damage. Or lupus, where it attacks multiple organs, including the skin, kidneys, and brain, leading to widespread inflammation. Number 6. Exposure to environmental pollutants and toxins can trigger chronic inflammation. These could be from air pollution, such as particulate matter, and ozone can induce respiratory inflammation and exacerbate conditions like asthma and chronic obstructive pulmonary disease. It could be toxins from chemicals, such as bisphenol A, and heavy metals like lead and mercury, which can disrupt immune function and promote inflammation. Number 7 is smoking. Tobacco smoke contains numerous toxins and free radicals that contribute to chronic inflammation. Smoking can cause inflammation of the airways and lung tissue, contributing to diseases such as chronic bronchitis and emphysema. The inflammatory response to smoking can affect multiple organs and increase the risk of cardiovascular disease, cancer, and other inflammatory conditions. Number 8 is chronic diseases. These can be a source of ongoing inflammation, such as diabetes, which can cause chronic high blood sugar levels that can lead to inflammation of blood vessels and tissues. Another is cardiovascular disease. This one can have conditions such as atherosclerosis involving chronic inflammation of the blood vessel walls. While lifestyle modifications like regular physical activity, a healthy diet, and stress management are important in reducing chronic inflammation, there are cases where medical interventions are necessary. These interventions can include pharmacological treatments, surgical procedures, and alternative therapies that target the underlying causes of inflammation. They include number 1, pharmacological treatments. This is commonly prescribed to manage chronic inflammation. These medications can be classified into several categories based on their action. They could be nonsteroidal anti-inflammatory drugs, for example, ibuprofen, naproxen, and aspirin. They are commonly used for conditions like arthritis, muscle pain, and other inflammatory conditions. However, long-term use can lead to side effects, such as gastrointestinal issues, cardiovascular risks, and kidney damage. Corticosteroids are another. These could be prednisone, hydrocortisone, and dexamethasone. These are used to mimic the effects of cortisol, which is a natural anti-inflammatory hormone. This group is used for severe inflammatory conditions such as rheumatoid arthritis, lupus, asthma, and inflammatory bowel disease. The side effect of these includes weight gain, osteoporosis, high blood pressure, and increased susceptibility to infections. Disease-modifying antirheumatic drugs include methotrexate, sulfasalazine, and leflunomide. These work by controlling the immune system and slowing the progression of autoimmune diseases. They are used for rheumatoid arthritis, psoriatic arthritis, and other autoimmune diseases. Regular monitoring is essential for this one as it may have potential liver toxicity and bone marrow suppression. Number 2 is surgical interventions. There may be cases where chronic inflammation leads to significant tissue damage, or other treatments fail, and surgical interventions may be necessary. There could be 3 different types of surgery. One is joint replacement surgery, which could be a hip or knee replacement, used for severe cases of osteoarthritis or rheumatoid arthritis where joint damage is extensive and causes significant pain and disability. This can be a significant reduction of pain and improve mobility, but I have had this done on my right hip, and now I am left with the right leg 3/4 inch longer than the other. Another surgery could be arthroscopic surgery, which is done on the knee, shoulder, or other joints. Slightly aggressive surgery is used to diagnose and treat joint problems, such as removing inflamed synovial tissue or repairing damaged cartilage. And the third is gastrointestinal surgery, resection of inflamed bowel segments in Crohn's disease or ulcerative colitis. It is done on people who have severe or complicated inflammatory bowel disease that does not respond to medical therapy. Number 3, alternative therapies can be used alongside medical treatments to manage inflammation. This could be acupuncture. This involves the insertion of thin needles into specific points on the body to stimulate the nervous system and release anti-inflammatory compounds. This is used for conditions like osteoarthritis, rheumatoid arthritis, and chronic back pain. Some studies suggest acupuncture can reduce inflammatory markers and improve symptoms, though more research is needed. I have tried this, but you must go to a certified person, and it got too expensive. In this next section, I shall explore how various environmental and lifestyle factors contribute to chronic inflammation. Number 1, diet and nutrition. When you have a lifetime inflammation, you can help yourself by changing your diet and avoiding all pro-inflammatory foods, such as processed foods. These are processed and refined foods, such as sugary snacks, fast food, and baked goods. All can lead to increased inflammation. Also, trans fats found in margarine, fried foods, and commercially baked products. Trans fats can increase levels of inflammatory markers. Refined carbohydrates such as white bread, white rice, and sugary cereals can cause spikes in blood sugar levels, leading to increased production of pro-inflammatory cytokines. Instead, it would help if you went for anti-inflammatory foods, such as fruit and vegetables. They are rich in antioxidants, vitamins, and minerals, and they help reduce oxidative stress and inflammation. Leafy greens, berries, and cruciferous vegetables are particularly beneficial. It will also help if you have omega-3 fatty acids found in salmon, mackerel, flax seeds, and walnuts. Other foods to eat are whole grains like oats, quinoa, and brown rice, which are high in fiber and help reduce inflammation by promoting healthy gut bacteria and reducing spikes in blood sugar. You can also try some herbs and spices, especially turmeric, ginger, and garlic. Also, green tea is good for you, as they are known for their anti-inflammatory and antioxidant properties. Number 2, you should do regular physical activity, because if you have prolonged periods of inactivity, you can lead to weight gain, insulin resistance, and increased levels of pro-inflammatory cytokines. An inactive lifestyle is linked to higher levels of inflammatory markers. You should have a regular exercise program, as it helps lower the levels of inflammatory markers and increases the production of anti-inflammatory cytokines. Exercise also improves metabolic health, reduces visceral fat, and enhances immune function. Each day try and go out for a walk, do some yoga, or swim. These are all low-impact exercises that can keep your joints moving. Number 3, inflammation can cause stress and mental health. Chronic stress triggers the release of cortisol and adrenaline, which can lead to prolonged inflammation. Stress also activates the sympathetic nervous system, increasing levels of pro-inflammatory cytokines. Some techniques that you could do to decrease inflammation include mindfulness meditation, yoga, deep breathing exercises, and progressive muscle relaxation can help reduce stress and lower inflammation. It is good if you engage in hobbies, and spending time with loved ones can also promote relaxation and well-being. Number 4 is sleeping. If you have difficulty sleeping, it can increase the levels of inflammatory markers. Sleep deficiency disrupts the regulation of the immune system, leading to increased inflammation. Deprived sleep can be linked to an increased risk of conditions including obesity, diabetes, cardiovascular disease, and depression, all of which are associated with inflammation. Number 5 is smoking. Tobacco smoke contains numerous toxins and free radicals that cause oxidative stress and inflammation. Smoking leads to chronic inflammation in the respiratory tract and other tissues. If you smoke, you should stop, as it can increase the risk of chronic diseases such as cardiovascular disease and cancer, all of which involve chronic inflammation. Number 6. Excessive alcohol. Excessive alcohol consumption can cause liver inflammation, or another name is alcoholic hepatitis, and systemic inflammation, and increase the risk of chronic diseases like liver cirrhosis, cardiovascular disease, and certain cancers. You need to moderate drinking alcohol. It should be 1 drink per day for women, and up to 2 drinks per day for men. Or opt for non-alcoholic beverages and prioritize hydration with water, herbal teas, and other healthy drinks to reduce inflammation. Number 7. Environmental factors. These could be pollution and toxins. Exposure to air pollutants, such as particulate matter, ozone, and nitrogen dioxide, can cause respiratory inflammation and exacerbate conditions like asthma. Long-term exposure is linked to systemic inflammation and increased cardiovascular risk. Exposure to chemicals such as industrial chemicals, pesticides, and other environmental toxins can lead to chronic inflammation and increase the risk of various diseases. Chronic inflammation can be influenced significantly by environmental and lifestyle factors. While genetic tendency plays a role, many aspects of an individual's surroundings and behaviors can either exacerbate or mitigate inflammatory processes. Understanding these factors is crucial for developing effective strategies to reduce chronic inflammation and improve overall health. Reducing inflammation in the body requires many approaches that include dietary changes, lifestyle modifications, and medical interventions. Incorporating anti-inflammatory foods, maintaining a healthy weight, managing stress, getting adequate sleep, and avoiding environmental toxins can significantly reduce chronic inflammation and improve overall health. Regular exercise and a healthy gut microbiome further support these efforts. Understanding and addressing the causes of inflammation can lead to better health outcomes and a reduced risk of chronic diseases. I am not a medical professional, and this video is for information only. If you have any worries, you should see your doctor. Thanks for watching this video. If you found it helpful, then please click the subscribe button and ring that bell to follow my channel, and give it a thumbs up. If you have any questions, please leave a comment below. I hope this has helped you, and good luck.